ahead and take the poll. Who do we have on the phone?
This is Cameron Perez. I'm on the phone.
Meg Zalatel on the phone.
Thank you.
Jamie Albert on the phone.
Forrest Dunbar on the phone.
Great. Good morning, everyone. Mr. Perez Verdia and Ms. Alta can be here in person, so they asked me to chair the meeting, but they're both on the line. And go ahead, starting with Mr. Rivera.
Felix Rivera.
Suzanne LaFrance.
Christopher Bronstedt.
And Austin Quinn Davidson. So we'll go ahead and get started with new business. We have a report from the health department. Dr. Sabbat, are you going to lead us in that report?
I'll try.
Go ahead.
Excuse me, Chair. This is Jamie Allard. I'm on the phone as well.
Oh, I heard Ms.
I don't know if you heard me.
I did. Thank you so much. We have Ms. Allard, Mr. Dunbar, Mr. Perez Verdia, and Ms. Salatel on the phone. Go ahead.
Okay, so hopefully everyone received the update Friday or Monday at the latest. So I'm just going to review the information. It's really not that much different than what you received last week. There are a few numbers that have gone up a little bit, but I'll review that and let you know where there were changes. So let's start off with just simply stating that Anchorage is still in a high-risk area. We're in a red zone that's defined by a positivity rate of greater than 5%. We are currently at 7%. That is unchanged from the week before. Our total COVID-19 cases are 37,170. That's from January 1st to approximately August 24th or August 14th, somewhere in there. Total COVID-19 deaths as of today, 212. Our reproduction number is still at 1.15 from last week. From the meeting a month ago, where it was at 1.36. That's down a little bit. It's not enough, of course. We want it to be below 1. Our vaccination rate for completed vaccination series is at 59.3%. That translates out to 144,654 individuals. The individuals with 1 vaccination is at 67.1%. That's at 163,556. New cases are at 184, with hospitalizations currently at 86. So again, the numbers are not where we want them to be. I'm going to give you today's numbers, which are actually yesterday's numbers for the hospitals. ANMC has 29 confirmed cases, 3 suspected cases, 9 are in the ICU. That's out of 19 available ICU beds, and 19 available, and all 19 are filled. 9 with COVID patients. 7 are on ventilators. There are 0 pediatric patients in ICU at this point for ANMC, and there were 2 deaths reported.
Dr. Sabbat, do you mind if I just note for the record that Mr. Wilson is joining us? Thank you. Go ahead.
Okay. Alaska Regional, 26 confirmed COVID cases, 0 suspected, 4 ICU patients out of 13 total ICU patients at 14 beds, 4 on vents, and 0 peds, and 0 mortality, 0 deaths. Providence, 31 confirmed, 3 are suspected, 7 in the ICU, 23 possible ICU beds, 23 occupied ICU beds, 7 of which are COVID, out of 28 total available ICU beds. And Matsu has 23 confirmed cases, 0 suspected cases, 7 are in the ICU. There is a total of 13 there out of 14 available beds, 4 on vents, 0 peds, 0 deaths. So you can see from those numbers that those 4 hospitals are either near capacity or at capacity. The problem still remains that we are seeing a lot of COVID cases, Delta variant by and large. The patients that are in the hospital by and large, it's in the 90 percentile. I'm sorry, 90 something percent. I'll tell you in a second. 91% of all cases are COVID or Delta. 92% of all hospitalizations are Delta, and 94% of all deaths are Delta. And these are, by and large, the unvaccinated. So that's a very high number. And the message there is get vaccinated. If you're not vaccinated, get vaccinated. If you've had one dose, complete the series. The vaccine is still our best weapon against COVID-19. Now, let's talk about who should get tested. Now, again, the information is going to be a little repetitious, but it's important. If you have been exposed to somebody with COVID-19, or if you have symptoms consistent with COVID-19, and some of those symptoms can look like allergy or just a GI problem, any kind of respiratory problem, there's no way to differentiate that short of getting tested. It's important to have early testing because early testing can lead to early treatment, whether you're vaccinated or unvaccinated, doesn't matter. Early testing, early treatment helps to prevent hospitalizations, helps to prevent deaths. Let's talk about the vaccination for a second. There's a lot of talk about the vaccination not being as effective against Delta as the original variant. That's true. However, it still does what we want it to do. It prevents severe death and it prevents death. So that's an important thing.
Dr. Sabbat, thank you. I have a couple folks in the queue. Mr. Perez-Rudia, did you want to go ahead now or wait until Dr. Sabbat's done with his entire presentation?
I think I can just wait. Thank you.
Okay, Mr. Dunbar, did you want to go now or wait?
Thank you, Madam Chair. I'd like to go now. So, well, I'll say first of all that I got tested 2 weeks ago and it came up negative, but I just wanted to compliment folks on it was very efficient. I went to LUSAC and the line wasn't that long. It happened to be that time, and I got my results within 24 hours. So I appreciate the efforts there. I wanted to ask a question related to the last portion of the presentation. Dr. Sabbat, so we hear a lot about people on ventilators, and I know that COVID treatments have improved, but I also have this sort of general impression, and this might be from a hangover from last year, but that when people are put on ventilators, for COVID-19, their survivability is not particularly good. That is, that a pretty high percentage of them die. Is that true? And do you happen to have statistics on that? You know, at this point, what percent of people that are put on a ventilator for COVID-19 survive?
So I don't have the statistics for the hospitals in Anchorage, but I can tell you nationally, about 50% of the patients who go on ventilators do not survive. So it's important to not end up in the hospital, in the ICU, on a vent, because with each step of the way, your chances of surviving decrease markedly. Does that answer your question, sir?
Yeah, I think it helps contextualize some of these numbers because the death numbers are such a trailing indicator. So we'll have a bunch of people in the hospital and we won't hear about a death until days or even weeks later. And it'll be, 4 people died, but we don't really know when it happened. It's just sort of when it's categorized that way and sort of catches up. So I think that it's useful. I mean, it's sad and it's morbid, but it's also useful to know that statistic in your head. And so when you hear there are X number of people ventilate on vents at these different hospitals, think in your mind, well, half of them are likely to die. And I might not know when or hear when, but unfortunately that's the case. And so that's a statistic I think is worth keeping in our minds. Thank you. Thank you, Madam Chair.
Yeah, thank you, Mr. Dunbar. I have another question from Mr. Weddleton.
So thanks. So you mentioned if you get tested, you can get earlier treatment. So which makes you think, what are those early treatments? And so if you get tested, you get a positive, we mostly just stay home is my impression. And then things hit a certain point that I guess you determined you would go in. What is that process? What is their treatment?
The recommendation is if you have a positive test, and especially if you're symptomatic, but maybe even if you're not symptomatic, call your healthcare provider. And if you don't have a healthcare provider, there is a hotline over at the Anchorage Health Department. I don't have that number in front of me. We can supply that. And have a discussion about what you should be doing. If you're unvaccinated, your risk is much higher, considered high risk. If you're immunocompromised, you're in a higher risk category, and those individuals are being urged to not only call and have that discussion, but those would be the ones that we're looking at monoclonal antibody therapy for. Now, monoclonal antibody therapy are antibodies that are directed against the virus, specifically the spike protein, which is what the virus uses to invade the cell. That's what makes you sick. So that has a very high success rate. If you are treated in the first 3 days, it can be as high as 80%, and it works very fast. You should, if not within the first 3 days, certainly within 10 days, be treated. After that, the effectiveness of the therapy diminishes. There are other things out there that are not FDA approved, which I'm not going to go into right now because they're not FDA approved or even under EUA, emergency use authorization. But that's really a discussion for an individual to have with their healthcare provider. But that's the big one. Monoclonal antibodies are given by infusion therapy. Regeneron, which is one of the trade names, can be given subcutaneously under the skin in 4 different sites. When I say sites, sites on the body, not sites out in town. And it's a one-time treatment, and it's very effective as well.
Good, thank you.
Thank you, Dr. Sabbat. Go ahead, Ms. LaFrance.
Thank you, Madam Chair. I have some other questions, but just following up on Mr. Weddleton's question and the monoclonal antibody treatment, and I know you and I exchanged some information last week or so, and thank you for that. Do you know, Dr. Sabbat, how many people are taking advantage of that option here? And I know there are a limited number of infusion centers, and if that number has increased, and what is the general supply of that treatment? Thank you, Doctor.
Okay, so I don't have the number of people that have done that, but I can get that for you. There are 2 sources, and I happen to break that down somewhere. Here we go. So we have 2 providers, Fairweather and WECA. Neither of them, by the way, are under contract with the municipality. They're private. One is static, one is mobile. So the static location, obviously, you would go to. You should call to make an appointment for that. The other is a mobile site, which means that they will come to people who are housebound or cannot get out for whatever reason. So there is an availability there. But for additional information, there is a number of people who can call. I'm sorry, what was the second part of the question?
Just how much supply is available to the community?
Sure. According to Mr. Cutchins, our lead pharmacist in the state, there is an ample supply of monoclonal antibody available for treatment. We're not going to run out anytime soon.
And may I follow up,
Sure,
Madam Chair?
Mr. Perez, go ahead.
Thank you. Thank you, Dr. Sabbat. Appreciate the
Sure.
information.
Sure.
And, on the report that you provided on Friday, it mentions, the monoclonal antibody treatment, and that's under the section of messaging to the public. And so this is a broader question. I'm wondering how many people know about the availability of the treatment, especially since there's a mobile center. And so my broader question is, what is the communication strategy for messaging this and the other aspects that are in the report? There's a section on recommendations for businesses. What is the municipality doing to get that message out to people? And maybe that is more appropriate to answer later, I don't know, but it's an overarching.
We can certainly answer that now.
Thank you, Madam Chair.
We have, as recently as yesterday, worked on the website, so the information will be on the Muni's website. And to give you a more complete answer, I happen to have our public information officer here. So if it would be all right, I would defer to her to answer that second part of that question.
Of course. Good morning. I'm Chelsea Ward-Waller. I'm the Public Information Officer for the Anchorage Health Department. So we sent out a press release last Monday. Not sure the date of that, but not this previous Monday, but the Monday before, regarding the monoclonal antibody treatment, specifically standing up that new static site. While the two providers of monoclonal antibody treatment in Anchorage aren't contractors for the municipality, we're working really closely with them in all of our operations to make sure that that service, that treatment is available, and figuring out what we can do if we need to expand those operations in case more people are requesting that as well. So the press release went out. We did get some follow-up earned media on that, which was great, and we're working on more earned media around it because we think it is a really important topic. We're working with Jocelyn Pemberton from the Alaska Hospitalist Group to figure out ways that we can better message to providers, because in communication with the state, we're hearing that some of the challenges with people accessing that treatment are just providers not fully understanding the treatment or understanding how to refer people to it. And then in our last push, both as a municipality and with the state, in terms of getting the information out there that this treatment is available, there's been some challenges with the public getting really excited about it and wanting to know more and calling the treatment centers before they've even tested positive. So there's messaging that needs to happen to providers that we're working on, and then there's also messaging that needs to happen to the general public about, as Dr. Sabbat spoke about, who is appropriate to get this treatment, when it's appropriate, and that type of thing, and then the process. And since it is something that we're really, it's a great opportunity to support our hospital capacity, and we need to get it going as quickly as possible, but there's also this challenge between the cart before the horse with the messaging and making sure it's clear, the opportunities and the system.
Very quick follow-up.
Sure.
When people get a positive COVID test, do you know, and I know that's largely through the state, are they notified then of the opportunity for this treatment?
So that's one of the messaging channels that we've been working with the state to improve, is to make sure that the email or the communication that goes out to somebody that gets their test results is the same across the board, regardless of where they get tested. And that's a little bit challenging because each of the contractors or each of the companies that's providing testing has their own communication. But we can encourage them to have a certain message, and we have just been going through cleaning up that messaging to make sure that it's the same and that it includes that treatment information.
Got it. Thank you so much. Thank you, Madam Chair.
Yeah, thank you for the question. I have a really quick one, and then we have a couple more folks in the queue. Dr. Sabbat, did you say the number out of 100,000 for the 14-day average? I didn't hear that one, and that's helpful for me to share.
Yeah, I can give you that. So the 14-day case rate average is 62.3 per 100,000.
Okay.
The 7-day test positivity, as I mentioned, is 7%. That's unchanged.
Great, that's perfect. That's
So
perfect.
I'd like to add something about the monoclonal antibody therapy, which is important. this should not be used in place of getting vaccinated, okay? Vaccinations are still the most important thing. And just because we have a very effective treatment for this doesn't mean that you should not get vaccinated. I want to stress that. That is very important.
Thank you, Dr. Sabbat. I have a question for Mr. Perez-Redia.
Sure.
Thank you, Madam Chair. Just a few questions. But before I ask my questions, I want to just share a quick story. I started having symptoms last week and went and got tested. I will say that after 3 days of waiting for my test, I ended up calling and asking them what the results of my tests were. And the person on the phone had to go into the lab and find my test in order to finally tell me that I was positive. So that took 3 days. And since then, it's been more than a week and a half. I have never received a phone call or an email from anyone from the state, no one following up on me at all. So just I wanted to balance that with Mr. Dunbar's story. My experience with both the testing and follow-up have been have not been to what I expected. My question, two questions. One, can you give us an update on the status of the hiring process for an epidemiologist and a health director? And also, can you share with us if that is creating a burden for your department? The second question is, we at one point had a goal set for vaccination rate for our city. I believe it was at 70%. Does the new administration, does the new health department intend on setting a goal as a way to encourage folks to get vaccinated? And where are we currently in terms of the overall percentage of people in Anchorage that are vaccinated in terms of a percentage? Thank you. Thank you, Madam Chair.
Okay, so let me try to take that in pieces. The need for an epidemiologist is.
Can I ask? Can folks on the phone hear Dr. Sabbat?
Yes.
Okay, great. Go ahead.
Thank you. The need for an epidemiologist, I think, is obvious. We are depending on the state epidemiologists for our information, and while that is good, solid information, we obviously need one because there are other issues in Anchorage besides COVID that we need to have a handle on. So in that respect, my position was put into the epidemiologist slot, and it has since changed to the medical officer slot where it more rightfully belongs. And we are advertising now, actively searching for an epidemiologist. So that part is already taking place. As far as a full-time replacement for the director of the health department, that is also going forward. Our interim director is actually holding down the fort with 2 jobs right now, her real job and her interim job, and she is overwhelmed. So we're looking forward to having those positions filled. I can't tell you specifically what other positions we need filled, but we are understaffed, and that makes it very difficult for the health department to be able to work at its best. Everybody is working very hard. They're putting in very long hours, but we do need those additional staff members to serve the community 100%.
Did you have any follow-ups, Mr. Perez-Redia?
Yes, thank you. That was the answer to one of my questions. The second one was related to the goal for vaccination rates for the city, whether you're planning on setting a goal and where we currently are with the overall percentage of vaccinated people in Anchorage.
Okay, so those with complete vaccinations are at 59.3%. with one vaccination, 67.1%. The goal of 70% is a good goal. It's a threshold goal. It's not, it's where we would actually like to start out from at the 70%, see it go higher. So in that respect, I think there's no reason to change that. I would like to see a more steady increase. I think as the surge goes up, continues to climb, we're seeing more people getting vaccinated. I think with the information about the hospitals out there, people are continuing and we're slowly increasing the numbers of people being vaccinated. The first time vaccinations are at 67.1%. Now that's nowhere near where we wanted to be at that 70%, of course, but at least we're moving in the right direction.
Thank you, Dr. Sabbat. Oh, go ahead, Ms. Wardwaller.
Yes, this is Chelsea Wardwaller. If I may just add, I believe those percentages are of the eligible population, not of our total Anchorage population. So there is just that consideration that, we still have this 12 and under 12 population that isn't able to get vaccinated right now.
And so that is 12 and above,
12 years in.
not 16 and above. So it switched from when we set that 70%.
Right,
Okay.
and that's an important point that you bring up. The Pfizer vaccine, which is now fully FDA approved, and we expect to see some of the vaccine hesitant individuals who've been waiting for that to go out and become vaccinated now. But it is fully approved for 16 and up. However, it can still be given to the 12-year-old and older population. It's just not fully approved for 12 years to under 16 years yet. But that's coming soon, from what I understand.
That's great. Thank you, Dr. Sabbat. I have a question from Ms. Salatel.
Thank you, Madam Chair. Last time we met, Dr. Sabbat, you were going to, and this was that work session around COVID, you said you were going to be meeting with the mayor to provide recommendations about what the municipality could be doing. I'd like to know what recommendations were made to the administration and how those are either similar or different for the recommendations for messaging to the public or local businesses that were contained in the last health department report, and then any feedback you received from the administration about what it intends to do in response to the rising COVID-19 rates. Thank you.
So I did meet with the mayor. I'm trying to remember. I think it was Monday afternoon, and we discussed the same considerations that I brought forward here. We talked about the vaccinations. We talked about immunity from either having a complete vaccination series to the original variant. We talked about the waning immunity, that is diminishing antibody levels, which you get with either natural disease or vaccination. We talked about those individuals who had the disease and have immunity as well. We talked about various aspects of that. We talked about the need to follow the CDC recommendations. I stressed the importance of doing all of the recommendations, not just picking one or two that you like or you think you can stick with, and how for any one of them to work, all of them need to be followed. That is, the physical distancing of, again, depends on who you read, but 3 to 6 feet. Most people look at 6 feet as the marker. We talked about the importance of hand hygiene, hand washing properly for 20 seconds or more. We talked about the usage of masks. The mayor is very data-driven. He has probably read as many studies out there as anybody I know, and he can point to studies that are pro and con. He still believes that people need to have all the available information to make a informed decision, which is what we do with patients all the time. We present the information to them, and it's up to them to make a decision. He has not mandated because he does not feel mandates are the way to go. But people in City Hall, if you walk around the building, if you have a chance, you'll see many people are either working, meeting with teams, as we recommended. There are a number of people that are wearing their masks. Some, of course, are not. But those recommendations have gone forward. And the same recommendations that are appropriate for the administration in City Hall are being conveyed to the public. The encouragement of businesses to follow those recommendations.
Can I ask just a quick follow-up, Madam Chair?
Sure, go ahead, Ms. Alto.
Okay, thank you. And that's actually more of a request. You know, I'm happy to hear that those recommendations have been made to municipal employees and departments. I haven't seen those come through, and I haven't seen any messaging from the mayor's office or the health department specific to municipal departments or municipal employees. So if those have gone out, it would be really helpful to see those forwarded, because if we can lead by example, I think that's a key piece to this, and it's consistent with the resolution the Assembly passed. So that was the reason for the question, is I hadn't seen anything to that effect. So if that exists, it'd be really helpful for it to be distributed. Thank you.
If I can just add something.
Sure, go ahead, Dr. Sabbat.
Some of that will appear on the website that goes out to the public. We forwarded those recommendations to the administration through HR, because HR has to be the one to make those recommendations to the employees, if you will. They are in the process of the messaging right now in the forms of questions and answers, which seems to be a preferred method to communicate. So that's all going forward, but we can supply that. In fact, I think it was supplied under this report submitted to the Assembly, under recommendations for local businesses. Encourage and continue to support telework when feasible, encourage virtual meetings, event organizers keeping number of participants small.
Thank you, Dr. Sabbat. I understand that. I'm sorry to interrupt, but I wanted to see how those recommendations were being specifically implemented or made to the employees of the municipality per department. And I understand that it's in HR. So when those emails go out, it'd be great if we could get screen captures of those or something, because we did ask the mayor to strongly encourage these things to occur, particularly within the municipality and to its employees. So that's the piece I'm missing, is how that's being implemented within the municipal business structure for the MOA to protect our employees. So I'll just look for that when it comes out, and just appreciate you keeping an eye out for it too. Thank you.
Thanks, Ms. Alto. Do we have any more questions? Ms. LaGrance, go ahead.
Thank you, Madam Chair. So Dr. Sabbat, we on the Assembly have been receiving a number of emails from members of the public who are very worried about the current situation, and they are not seeing action on the part of municipal leadership. And so maybe there's a disconnect with messaging. I'm just letting you know that, because sometimes we receive feedback that I know doesn't get to the mayor's office. And so, for example, I received an email yesterday from someone in my district who works in the ICU, And just a part of it, he said, I strongly believe the simple measures of masking and social distancing would go a long way. Vaccination would have likely averted the situation. I currently see no action taken from leadership, which is troubling. We may get lucky and somehow live through, but we are certainly not preparing for the worst and hoping for the best. I urge you and other members of the Assembly to take action. So we are hearing more of that from members of the public, again, who are worried, who are hearing that the ICUs are full, who are being told if they need, just treatment from a car accident. And I know there are other contributing factors to the load, who are feeling like, okay, maybe they shouldn't be going anywhere this Labor Day weekend because they don't want to risk their family not being treated in a timely fashion if they get in an accident. So I'm sharing that with you and also asking, I think it's probably safe to say the mayor is not intending to require masks or implement any capacity limitations. And I'm wondering about, and along the lines of Ms. Elgil's question too, what is being done? I mean, maybe signage could be given out to businesses. I don't know. I don't know what kind of ongoing communications the administration is having with the hospitals, for example. And because we're hearing more and more since that work session, it's been ongoing about the dire nature of the situation. So I'd like to know, and it doesn't have to be here, exactly what's going on. What's the plan if this gets worse? And what resources do you need? If it's a matter of resources and appropriations for more staffing in order to help keep the public safe, I think that's something members of the body definitely would consider. So please tell us what is needed resource-wise and what's the plan, and how do we respond to these folks who are asking for us to do something, knowing that the administration has said we're not going to do these things. So what's left? How can we work together to help protect the health and safety of the public? Thanks. Thank you, Madam Chair. Yep.
So it's a great question, and unfortunately, I probably don't have a complete answer for you at this time, but I will say that while it's important for local leaders to put out the message, I think there are other sources that are equally important. I think the health department, for one, and we are doing that. We will increase our efforts. Certainly, I have 2 opinion pieces that are ready to go out to local newspapers. I will be writing more as the time goes by, encouraging vaccinations and the masking and the hand hygiene and the distancing, ventilation, outdoor versus indoor, virtual meetings, and so on. The website, as I alluded to earlier, is being reworked. It's just about finished. We just have to change some of the graphics. I think that the medical community is involved. I think people trust their providers probably more than they trust someone they don't know getting up and telling them what to do. In most cases, they've formed a relationship which provides that trust. I know when I was in practice and I talk about vaccinations with families, because I was their physician, they knew me, they could trust what I was telling them because they knew it was in their best interest. They were more willing to accept some of the risks of some of the vaccinations, even if they initially thought they wouldn't do it. I know our primary care providers are doing a good job with that. I think that is an important part of the picture that has not been emphasized. I don't want it to get to the ICU intensivists and the ICU nursing staff to have to tell people this is what you should have done. It's more important that the rest of us tell people what they should do going forward before it gets to that point. So I agree, the messaging is very important. We're going to continue what we've been doing and to increase those efforts as well.
Thank you. And a quick comment, and I would say whatever you can do to amplify that message is critical. If the mayor would consider asking people to wear masks, if he would ask them to get vaccinated, I think that would go a long way in helping our community. Also, last year, Governor Dunleavy sent out an emergency message saying, you know, the COVID situation was dire. And I think that had a positive impact on people. So I know we don't have Nixle, and I can't remember what we have in place of Nixle, but if there's some way to send out a broadcast, because without any mask mandate or capacity restrictions, I don't know if some folks don't realize yet, I mean, how dire it is. Thank you, Madam Chair.
Yeah.
Chelsea, do you have anything you want to add to that in terms of the messaging?
Chelsea, I would just say that we do have Nixle.
Oh, we do.
We do have that opportunity. We have used it for updates throughout, and you know, has come and gone with the frequency that we've used it, because one of those things that if you get too much messaging, you don't pay attention to any of it. But I agree that now might be a very appropriate time to think about that. And I would just go back to sort of thinking about what else can we be doing. I want to assure you that between the health department and the emergency operations center, we are constantly looking at the situation, talking to the hospitals as frequently as we can, both, you know, from my level to my counterparts, the PIOs at the hospitals, and then through the emergency operations center external briefing that you may be tuned into. But we're, you know, as I mentioned with the monoclonal antibodies, we're not just thinking about what we need today, but we're thinking about what that capacity needs to be in the future. The same for testing. Do we need to extend hours? Do we need to open another site? This is a lot of people's full-time effort, and just want to assure you that it's not, while the situation is incredibly challenging, a lot of people are working really hard to make sure that we're not just planning for today, but planning for the future.
And thank you for all you're doing. I can't imagine how difficult and challenging your job must be. And so just thank you very much for your long hours and hard work. Thank you, Madam Chair.
Yeah, I have a couple more questions, and I know that Dr. Sabbat, you needed to leave at a certain time. We also have a member of the public who I'm sure would like to give public comment. So let's move through them quickly if we can. Oh, yours is the dean question. You want to do that? Okay. So Mr. Rivera, you want to go ahead and say?
Yeah, thank you, Madam Chair. So I think it was last week, the governor did a COVID-19 update, and sort of riffing off of what Ms. LaFrance said, is the mayor considering doing a COVID-19 update anytime in the near future?
I know he's done the public service announcement a week or so ago. I don't know, I don't have the answer to that, but I will ask him if he's planning.
I just want to be very specific when you do ask him, which I really appreciate. So what the governor did was, you know, like a traditional press conference kind of update. And so that's the specific question that I have.
Okay, thank you.
Thank you.
I think what he did, was it a COVID ad or something? I remember seeing it. Okay, well, I think, do we have a couple more minutes, Dr. Sabbat, or do you need
Sure.
to? Okay, Mr. Williamson, do you want to go ahead, and then in case?
So Dean, we've gotten a lot of emails saying the assembly has to act because the mayor isn't. For the assembly, hypothetically, to say we need a mask mandate, if we need business closures or whatever it might be, paralleling what we did last year, I assume we can do an ordinance. If that happened and if it passed, then it lands on the mayor to make it so. If he chooses not to, which is, you know, kind of where he is, then what happens?
Well, I guess that's sort of a multi-part question, perhaps. First, the assembly could act. You can do an ordinance, like you said, especially if you want it to be something enforceable as a matter of law, similar to the emergency orders that the mayor issued last year. You can do it by ordinance or emergency ordinance if you know the urgency and the circumstances justify calling it an emergency. So you could act that way as well. Emergency ordinances are only effective for 60 days, or an ordinance can be effective until you say review it. And then for a mask mandate or whatever other regulations that the assembly, I guess, teams. And then the second part, if I understood it right, directing the mayor to do something by passing an ordinance. And I guess if you do pass an ordinance with a mask mandate, for example, the enforcement of it is on the executive branch to carry out the law and so forth. So that's supposed to be faithfully done, faithfully execute the laws passed by the assembly. So I guess if it's not being done, then the view of the assembly, I guess we cross that bridge when we get there. When you say what happens next, it's hard to think of this hypothetically speaking.
Okay, no, it's fine, thank you.
Thank you, Mr. Weddleton. Do we have any other questions for Mr. Waller and Dr. Sabbat? If not, we'll let them go. Okay, thank you so much for being here. Oh, go ahead, Chelsea.
Sorry, if I could just add 2 more clarifications, Chelsea Wardwaller. I wanted to let you all know that we are meeting with ACNA at 11, the State Hospital Nursing Home Association, and that's the meeting that Dr. Sabbat is heading to. And then I also just wanted to follow up, I think, I apologize for not catching this, there was a comment about contact tracing, and I just wanted to let you all know that the contact tracing teams are going through a prioritization of contact tracing right now for cases, so they are not necessarily contact tracing everybody in some cases that they might not be able to in a matter of several days. You know, we're really encouraging everybody to do their own contact tracing as much as possible. So that's where we're at with the case count.
Thank you both so much for being here.
Thank you for having us.
Thank you. Oh, can I ask you a quick question, Dr. Sabbat?
Sure.
I'm sorry, did you say that you are looking for epidemiologists? Is that position being flown, or are you just word of mouth, or not that I know any epidemiologists, but
I don't know how they actually do the search, but I know HR is actively searching.
okay, great, thank you.
And I hope they find someone soon.
Yeah, I bet you do. Great, okay, thanks so much.
Okay, thank
With
you.
that, I think we'll move on to number 4 on the agenda. Mr. Perez, did you want to speak to anything to cover with regard to legislative priorities or budget items?
No, Madam Chair, thank you for the opportunity, but I think we can move on to public comment.
Okay, did anyone else have anything they want to add with regard to the 4? Okay, thanks so much. We'll move on to audience participation. Mr. Haberman, would you like?
My name is Eugene Hagman. I represent myself. Follow the public process. When the public process is done appropriately, decision made by the governing body is more like the public interest. I'm sorry that the health department representatives just left and couldn't hear from public comment. We had a few minutes left to the meeting, and it's sad that they can't hear from members of the public. Number 1 is at the last regular Senate meeting in Lusac Library in final participation, I noted that I witnessed not seeing a single member of the administration's heads wearing face coverings and caused alarm. The mayor has not said that they couldn't wear it, at least publicly, but they were not doing it. But as recently as yesterday, I witnessed, I believe, the city attorney present in this small room wearing a face covering, and the health representative who did this report today wearing a face covering. Whereas the entire time of that previous meeting, or the regular meeting of the Assembly in Lusac, he was not wearing it at all. So what can be done? We could do a lot more than what's going on right now, particularly being responsible and wearing face coverings. And that's the least we can do. I'm glad to see Assembly members present, all present here, wearing face coverings. But the fact is, even before COVID, this room was not suitable for an Assembly meeting in City Hall. And these meetings needed to be at Lusac Library, and that's where it needs to be done. And COVID's still rising and concerned by many throughout the country. And we had 2 special Assembly meetings in this small room, one yesterday and one last Friday. And the end result is this is not fair and responsible to the Assembly. Move those meetings to the Lusac Library where they belong, and where it's safer than dealing with COVID. I'd like to make a reference to the governor's statement last week in his press conference. His answer in dealing with COVID was Ask your doctors. That's his answer to COVID and dealing with it. He was not going to proceed to dealing with anything about requiring anybody to do anything, and it's more of the same. That same attitude appears to be coming from the administration upstairs, and this is disappointing and alarming. And with all due respect, we're concerned about the business community, and particularly in Alaska. And how can people and have a future in business if we don't soundly deal with COVID and be responsible? The situation in our community and our country didn't have to be as bad as it went, both for the business and health. But it was because of the irresponsibility and leadership and directions that have happened over administrations, both local and state and national, that we've continued dealing with the situation.
Mr. Haber.
And the comment and wish you all the best, but stop holding these meetings here. Thank you very much.
And Mr. Haberman, if you'd like to submit anything in writing that you want Dr. Sabbat and Ms. Wardwaller to see, I would be happy to forward it to them.
Can I make one reference with respect to in writing? Remember when I made a statement before the assembly at the regular assembly meeting and informed you that people who submit communications on that for the time with hearings and all that, that I informed the assembly and the public that those communications are being doctored, and nothing's happened since. So,
Okay, well, it's at your election. I'm just offering that. If it would be helpful. I think we have another member of the public here. Would you like to speak? No?
Yes.
Yes? Okay, please go ahead.
Okay.
You'll have 3 minutes. Please introduce yourself in the record.
Yeah, I'd like to introduce myself. I'm Al Timani, Vice President of Midtown Community Council, and we're concerned about the number of packaged liquor stores in our area. We understand there's an application for a new one, and we, of course.
Yeah, it's okay. I mean, he can speak here if he wants, if there's a health impact. People are raising their hands because they're just suggesting that your testimony is probably for the public safety committee. But if you'd like to talk about the health impacts, I think there's no problem with you going ahead.
Yes.
Please proceed.
Mm-hmm. I think that we take a look at the saturations that we have in that area now, and of course, the number of accidents and et cetera that we've had, that it's a health factor. And so therefore, I want to hand out to the assembly copies of all types of licenses in the Midtown Community Council and Spenard. And I think in the future, just some advice is you may request the city clerk to provide you these maps so that when you take a look at something, at a license or a renewal, that you can at least have an idea how many are in that area. So I'd like to hand these out. Felix?
Just give it to the clerk and the clerk will hand it out to everyone.
Clerk, hand these out. Great. I'll answer any questions you may have. Hearing none. Thank you.
Any questions? Okay, thank you, Mr. Smarty. And just for clarification, this is the end of the Health Policy Committee meeting.
Okay.
And we'll have audience participation for the Public Safety Committee as well. Okay, any other comments from members? Okay, with that, we'll go ahead and end this meeting. Thank you.